Laura Watson. She is 21 years old and she lives in Langley. In January 2013, she noticed a large lump on her right humerus. What made you think this was something that you should probably see your family doctor about?
It just felt really abnormal, and comparing it to my other arm, there was quite a bit of a difference. So I wanted to see my doctor just to clarify what was going on with that.
And what hospitals did you have to go to?
I went to 3 different hospitals. I went to Langley Memorial a few times, and then I went to Abbotsford General, and then I went to Vancouver General.
And which was your favorite hospital?
Out of the 3, I'd have to say Vancouver General was my favorite. They were really professional and organized, as well as they were really accommodating.
And which was your least favorite?
My least favorite was definitely Langley Memorial. I went there a number of times, and I just didn't get a good vibe. There was a few staff members that didn't make me feel very welcome, and they were just, it seemed a little scattered and unorganized, the hospital.
And what tests did you have done?
I first had an ultrasound done, and then I had an x-ray, and then after that I had an MRI.
So what was the final diagnosis?
It took a really long time for my diagnosis. I had to see a few different doctors because of it. It first started with my family doctor.
With the lump, yes.
Yeah, he sent me to get an ultrasound of it, and then when it came back, he told me it was probably just a calcium buildup. Like, he was 99% sure it was fine, it would just have to be broken down, and but he couldn't really give me that full 100%. So he wanted me to get an x-ray done so they could have a better view of it. After I got the x-ray done, I went back to him, and he had bad news. He told me that it wasn't a calcium buildup. It was either an osteochondroma, which is a benign bone tumor, or osteosarcoma, which is a cancerous bone tumor. After that, I was pretty upset. He still couldn't make that full diagnosis. That wasn't really his area of specialties. He was a general practitioner. So he sent me to see a bone surgeon, and he looked at the x-rays, and he told me that basically the same thing. It was very abnormal, and he doesn't see a lot of those, so he couldn't make the diagnosis as well. He wanted to get a better view, so he sent me to get an MRI done. After the MRI, I went back to see him, and it was the same thing again. He couldn't make that diagnosis even with a better view.
Lots of waiting.
Yeah, and so I had to be referred to a bone cancer surgeon, which took a really long time because there's only, I think, 1 or 2 of them in British Columbia. So I waited about a month for that appointment after the MRI, and I went to see him and waited a while in the waiting room. And then when he came in, he brought a whole crew. I think it was 8 doctors with him. So I was feeling really worried that it was going to be bad news. But it ended up being good news. It was just an osteochondroma, so the benign bone tumor. And after that, I just felt really relieved.
Do they know what caused it?
No, not really. I mean, it just kind of grows over time. It could have been born with it, or it just kind of grew as I got older.
Yeah. Just benign.
Yeah.
And does it bother you or cause pain?
It never did before. It was just kind of there, but as I've seen all the different doctors, they really had to feel it vigorously to get an idea of what it felt like, and it started to feel a bit bruised. Didn't hurt a lot, just felt a little bit bruised as I moved it.
Irritated from somebody.
Yeah, it was definitely irritated.
Yes, of course. Do you have any regular checkups involving that, or is it?
They say that the #1 symptom for an osteochondroma turning to osteosarcoma is pain in that area. So it would be really painful. So if that ever does start happening, I have to go get another MRI done, and then have a follow-up with the bone cancer surgeon as well.
Oh. So were there any staff members that stood out to you?
There was a few, actually. There's a couple good and bad. When I was at Langley Memorial, I remember my ultrasound appointment, like showing up for the time that they given me, and they had no idea that I was supposed to be having it at that time. Like it was just really unorganized. I think it was a unit clerk that was just very rude to me and like non-apologetic for like how it affected my day. How was I
organized?
Yeah, and I had to wait like a really long time for them to fit me in like throughout that day, even though it was their mistake. Also, the X-ray technician at Langley Memorial, as she was taking my X-ray, she made like really kind of weird facial expressions, like kind of like worrisome or
Make you
like
uneasy.
yeah, it made me feel really uneasy. Just the way she's like the vibe that I got from her and the way she's looking at things, like it wasn't very professional. Some good staff that I did come across were some of the doctors, like my family doctor, as well as the bone surgeon and the bone cancer surgeon. They were all very nice and understanding, and they were patient with all my questions, so that was good.
Oh.
Yeah. And then one of the volunteer workers at Vancouver General that really stood out to me. The waiting room, it took a really long time to come in to see the doctor because he's a surgeon. I think he only has 1 day a week where he actually sees patients because he does surgeries on all the other days. So there was quite a few patients there. It takes a really long time. And the volunteer worker, she was going around to everyone, making sure they were comfortable. She was bringing like coffee or tea or water to whoever needed it. There was also one patient who was waiting by herself, and she seemed like really stressed out and upset. And she sat down with her and made her feel a lot better. So she really stood out to me as like a great person.
So what was the environment like in the hospital?
It was very different for like each area that I went to. Like when I went for my ultrasound and X-ray and MRI, like it was all just kind of like a regular environment because it was just people going in for tests. Like I didn't notice anything different. Like it was kind of normal. But when I did go to Vancouver General in the bone cancer unit, it was kind of a sad environment because you could tell like pretty much everyone there did have bone cancer, and that's why they're having follow-ups with the surgeon. So it was a little upsetting seeing some people. Like there was one like really young girl, and she was with her whole family, and she just seemed really sad.
It's hard to see. So how did this make you feel, this whole experience?
It made me feel many different feelings throughout the whole thing. At first, when I first noticed it, I was a little bit worried. I didn't want to stress too much about it. After seeing my doctor and him telling me that it was probably just a calcium buildup, I felt a little bit relieved. And then after that, I was pretty angry when I found out that it was either cancer or like a benign tumor, because I kind of thought I got my diagnosis already. So I was a little angry, not for long though. But then between...
Just upset probably too.
Yeah, for sure. But throughout the time of my MRI and waiting to see the bone cancer surgeon, it was really long. So I was kind of focusing on the negatives, like what would happen to my life if I did have bone cancer. So I was really like kind of sad and depressed throughout that time. It was rough. But after seeing the bone cancer surgeon, he told me that everything was fine. So I just felt really relieved and stress-free, and I could kind of start my life again, you know?
And so overall, has this experience taught you anything?
I think so. I think it's really shown me like what it's like for some patients in the hospital, what they go through, like having to wait for all those tests and talking to doctors. I mean, I ended up being fine, but I think it gave me a better idea of like the stress and what you go through with your family and friends and having to talk to people about it.
Great. Well, thank you very much, Laura.
You're welcome.